Sergeant Lugo, we're live.
Thank you. Sergeant Bradley, with your recording, please.
PC is up.
Cloud is up. Good afternoon, everyone. Welcome to today's remote New York City Council vote of the Committee on Health. At this time, would all panelists please turn on your videos. To minimize disruption, please place electronic devices to vibrate or silent. Thank you for your cooperation. Chair, we are ready to begin.
Thank you so much, Sergeant. I am Mark Levine, Chair of the City Council's Health Committee. I am pleased that we are joined by fellow council members and committee members, Councilmember Diaz, Councilmember Powers, Councilmember Holden, Councilmember Ampry Samuel, Councilmember Barron, Councilmember Brooks Powers, and forgive me if I've missed, I think Councilmember Yeager may be on. And if I've missed any of you, I will acknowledge you momentarily. We are hearing today, actually voting today, on an important piece of legislation, Intro 1326B, which I'm proud to sponsor, which requires added sugar notifications in chain restaurants. We'll also vote on Reso 638, sponsored by Councilmember Dr. Matthew Eugene, who is also here with us, which calls on the New York State Department of Health to create standalone, self-contained isolation centers or units for the treatment of patients with infectious disease due to epidemic, including highly contagious and airborne diseases. And I'm happy that Councilmember Eugene will be sharing a few words on his resolution momentarily. First, Intro 1326B would require that the Department of Health and Mental Hygiene issue a rule designating an icon to be placed in a clear and conspicuous manner on menus or menu boards adjacent to the listed prepackaged foods and prepackaged food items on display that exceed a specified level of added sugars, including but not limited to 100% or more of the daily value for added sugars. Such a rule would also provide a factual warning statement about high added sugar intake, which can have serious health consequences, including diabetes and obesity. It's estimated that more than 100 million Americans have diabetes or prediabetes, including an estimated 987,000 New Yorkers. Diabetes disproportionately impacts New Yorkers based on their economic, racial, and ethnic backgrounds, with Black, Hispanic, and Asian New Yorkers being twice as likely as white New Yorkers to have diabetes as of 2013. Diabetes disproportionately affects high poverty communities in New York City, where the neighborhoods with the highest prevalence were Fordham Bronx Park, East New York, Williamsburg Bushwick, Northeast Bronx, and the South Bronx. According to DOHMH, more than half of adult New Yorkers are overweight, 34%, or obese, 22%, while almost half of all elementary school students and Head Start children are currently at an unhealthy weight. As we continue to witness the health impacts of COVID-19, we must do what we can to help our communities become healthier, which requires centering equity. We must do more to improve the long-term health of our communities, especially those marginalized and disproportionately impacted by inaccessibility to healthy food options. Intro 1326B helps address some of these concerns by clearly labeling foods that can be harmful to one's health. Prepared food is a growing and problematic part of New Yorkers' diets, particularly among children, making up approximately 25% of a child's daily calories on average. Consumption of restaurant food has been linked with increased caloric intake, poor nutrition, and higher risk for being overweight and obese. By requiring chain restaurants, specifically those with 15 or more stores, to post an icon on or next to a prepackaged food item on display or next to a prepackaged food item listed on the menu or menu board, and to post a warning statement at the point of purchase, we can make the health content of one's options more apparent. The heart of this bill is consumer empowerment, and I'm proud of this legislation and confident that it will successfully provide a clearer path for individuals to make more informed choices. I want to thank my colleagues from the Health Committee again for being here. I think we've also been joined by Councilmember Felix, and I want to also thank the incredible staff of the Health Committee, Councilors Harbani Ahuja and Sarah Liss, Policy Analyst Ann Balkin, and Finance Analyst Lauren Hunt, for their work on this legislation. Thank you again. And now I'm going to pass it to Councilmember Matthew Eugene for remarks on his reso. Please, Dr. Eugene.
Thank you very much, Mr. Chair. Thank you so very much. And thank you also for your leadership on behalf of all New Yorkers. And thank you to my colleagues on the Health Committee for your support on this very important legislation. I'm proud to sponsor Resolution 638, calling on the New York State Department of Health to create stand-alone, self-contained medical centers or units for the treatment of patients with infectious disease due to epidemic, including highly contagious and airborne disease. As a medical doctor and as a public servant, I've been concerned for many years of the greater danger that a public health emergency such as COVID-19 would be to our general populations, especially in an area with high population density like New York City. I saw the issues that a lack of hospital capacity during Hurricane Sandy. And as we all are aware, the same situation made it incredibly difficult for our medical professionals to provide the proper care for patients with COVID-19 in safe environment, and ultimately created a crisis for us that we must learn from so that we do not repeat the tragedy that unfolded last year. I want the great city of New York to be more prepared for the next spread of contagious disease. And as we have seen with COVID-19, viruses can mutate and have the ability to cause sickness and illness despite the best preventive measure on the part of the general population. If we can contain a disease at its outset, we are much more likely to prevent an outbreak and the domino effect that these health issues have had on the city and our infrastructure. Everything was shut down during COVID-19, and we will be feeling the financial implication for many years to come. This is an area where I am confident that we can improve our ability to respond and protect the community. And it is one where we must act on with a greater sense of urgency. As public servants, it is our moral obligation and responsibility to do everything that we can do to save life. And I believe that having stand-alone medical center or units will put our city in a much better position to handle and control the next public health crisis. This legislation will not only benefit those who are sick, it will ease the burden that the public health crisis has on our healthcare workers and all those who are involved in keeping the city running when there is a public health emergency. This legislation will save lives and will prepare our city for a more prosperous future against the threat of infectious disease. I want to thank Speaker Johnson and also Jason Golden, Jeff Baker, and all the wonderful staff of the City Council and all my colleagues for their support. And again, Mr. Chair, thank you so very much for your leadership and your advocacy on behalf of the City of New York. Thank you very much.
Thank you, Councilmember Eugene. We now have every member of the Health Committee present. Thank you for that, everyone. We're going to ask now the committee clerk to call the roll call for the vote.
Thank you and good afternoon. This is a roll call vote on the Committee on Health. Intro 1326B and Resolution 0638. Chair Levine.
I vote aye.
Councilmember Eugene.
I vote aye.
Councilmember Barron.
Thank you. I vote aye.
Councilmember Ampry Samuel,
I vote aye.
Councilmember Holden,
I vote aye.
Councilmember Powers.
Just quick permission to explain my vote.
Of course, please.
Thank you. For starters, I want to say I'm voting aye on all, and including the bill on the labeling nutrition bill. And I think it's a good bill, and also I think we hopefully the next council will be able to even go further with it in some places where I think we could do more. But beyond that, I just want to commend our future borough president and our chair Levine for being just an absolute rock star health committee chair over the last 4 years. On the committee has he done a great job, but during the pandemic, there's been no public servant, the public elected official that I know that has done more for New Yorkers to be able to communicate and articulate what is happening at any particular moment and be the voice of reason. So I want to commend him. It's not a farewell. The guy's got to get in a pretty good job next year. But either way, I want to say my thanks for him for being a great chair and certainly for all the work he's done over the last 4 years.
My goodness, that was the best explanation of a vote I think I've ever heard. Thank you so much, Councilmember Powers, for your words. It really means a lot. Grateful for your partnership as well.
Absolutely.
Thank you.
Councilmember Dharma Diaz,
Yes.
Councilmember Brooks Powers,
Aye.
Councilmember Felice.
Aye on all.
Thank you. Chair Levine, by a vote of 9 in the affirmative, 0 in the negative, and 0 abstentions, both items were adopted.
Thank you so much. We have full voting, so we will close the committee hearing. Thank